My name is Dr. Pamela Dongo. I work with JSI-led Regional Health Integration to improve health services, RHITES-North Lango project in Uganda. PEPFAR has been in Uganda since 2004, and it came into Uganda early on in the country's efforts to address the HIV epidemic. As you all know, Uganda was really hit by HIV, and PEPFAR really supported the government of Uganda to highlight the country's needs, led country's interventions to address the HIV epidemic, and we've had some really, really good milestones in addressing the HIV epidemic. This is known globally. We've been able to scale up HIV services to the lowest level of health centers in the country. Largely, the collaboration between government of Uganda and PEPFAR has really, really been key. We have free antiretroviral drugs in the country for adults, for children, for pregnant women. Uganda has made key milestones in achieving the 95-95-95 targets. Yes, there are gaps, but the government, together with PEPFAR and the various partners in the country, have come together to revise the country's HIV strategic plan that responds to the issues that we need to address in country to address HIV and TB in Uganda. We are on track for achieving the indicators, but there are gaps. Uganda and PEPFAR need to come together and re-strategize how to reach and address the problem around key populations where the HIV epidemic is still high. We need to look at our priority populations. We need to focus on adolescent girls and young women. We need to address issues around stigma, but also the comorbidities that are coming up with HIV. People are living longer, but we have an upsurge of some of the other health conditions that are related. We need to address mental health issues among people living with HIV. We need to address the issues around non-communicable diseases, and we need to re-strategize how to enhance the health workforce to address the HIV situation in Uganda. Right from the beginning, when PEPFAR's goal was to ensure that we transition 75% of the HIV and TB funding to the local organizations in country, my organization was at the forefront of ensuring that this happens. In the last 2 years, we have transitioned all the HIV and TB service delivery in the Lango sub-region where we work to local partners. We needed to identify key local organizations that could receive funding directly from PEPFAR. We built their capacity, provided technical support, ensured that they adhered to the policies, both technical policies but also financial policies, and ensure that they are able to provide services. The key thing, despite whether PEPFAR is in country or not, is to ensure that the last person, the beneficiaries, do not miss services, and ensure that there's a smooth transition, to ensure that even if there's a change in systems between PEPFAR and government of Uganda, that the HIV and TB services are sustained. And I think that this was at the forefront of all the support that we are giving. Government of Uganda has worked with PEPFAR to ensure that these systems are sustained and there's no break in services in the region where we work. Key populations are very important when it comes to addressing the HIV epidemic. And I think PEPFAR has been at the forefront of supporting our governments to recognize that there is a problem. PEPFAR has been very key in highlighting the gap that we have for HIV service delivery in these people. It has supported us to map and do size estimates. We do know that, yes, there are key populations in country, but to map and identify how many they are, where they are, and what services they're missing. PEPFAR has also provided a platform for the key populations to speak to the service providers and the donors and government of Uganda about their needs, what their gaps are, where they feel the services are not reaching them, and we have been able to design programs with them that reach them, that respond to their needs. PEPFAR has funded a lot of the services that we provide. We've been able to have key health innovations because of PEPFAR. We've been able to scale up HIV self-testing, pre-exposure prophylaxis for these populations, and other key health interventions largely funded by PEPFAR that responds to the needs of the key populations.